Howdy everybody, welcome back to MSK. My name is Jonathan. Today we are continuing to go over the terminal branches of the brachial plexus, and we will be talking about the median nerve. Let's get into it. Alright, we're going to start with our roadmap of the brachial plexus and walk through how we get to the median nerve from the individual nerve root. C5 and C6 will join together to form the superior trunk, where they will move on to form the lateral cord. C7 will form the middle trunk and then make an anterior division to join the lateral cord, which will then go on to form one part of the median nerve. C8 and T1 will join together to form the inferior trunk, where they will continue on to form the medial cord and complete the median nerve. So as we just discussed, the nerve roots of the median nerve will include C5 to T1, which is all the nerve roots of the brachial plexus. Alright, let's move on and talk about the motor innervation of the median nerve. The median nerve will innervate most flexors of the forearm, which are these group of muscles down here. Importantly, this has two exceptions. The first exception is the flexor carpi ulnaris, this muscle marked out here in red. As the name suggests, this muscle is innervated by the ulnar nerve, not the median nerve. The second exception is the ulnar side of the flexor digitorum profundus. As the name suggests, the flexor digitorum profundus will flex each of the fingers excluding the thumb. So, there will be a tendon that goes down to reach each finger. The lateral or the radial side will be innervated by the median nerve, while the medial or the ulnar side will be innervated by the ulnar nerve. So again, most flexors of the forearm are innervated by the median nerve, with the exception of the flexor carpi ulnaris and the ulnar side of the flexor digitorum profundus. As the name implies, these will be responsible for wrist and finger flexion. Additionally, the median nerve is responsible for innervation of the first and second lumbricals of the hand. The lumbricals are these worm-like muscles in the hand, and similar to the flexor digitorum profundus, will be split innervated between the median nerve and the ulnar nerve. The median nerve will innervate lumbricals 1 and 2, located here on the radial side of the hand, and the ulnar nerve will innervate lumbricals 3 and 4 here on the ulnar side of the hand. The action of the lumbricals is to flex at the metacarpal phalangeal joint here and to extend at the proximal and distal interphalangeal joints up here. So if it's lumbricals day at the gym, what are you going to do? So we'll start with a relaxed hand, and first I will extend at the distal and proximal interphalangeal joints, and then I will flex at the metacarpal phalangeal joints, leaving me with this shape of a hand. Now here I am using all of my lumbricals, but remember the median nerve only innervates the first two lumbricals, so it will only cause this action. Injury to these lumbricals of the median nerve can lead to something called hand of benediction. This hand distortion will have its own video, but I'll go over it briefly here. If a patient comes in with median nerve injury and the first two lumbricals won't work, when you ask them to make a fist, they'll be able to flex the metacarpal phalangeal joints at the outer two because that's innervated by the ulnar nerve, but not these two fingers, leaving them with something that we call the hand of benediction or Pope's blessing. You're blessed. And lastly, the median nerve is going to innervate the thenar muscles of the hand. The thenar compartment is the group of muscles at the base of the thumb down here and will assist with the fine motor movements of the thumb. So we'll have abduction, which will be coming from the abductor pollicis brevis. An abduction of the thumb will move the thumb away from the fingers. You have abduction, as well as flexion, which will come from the flexor pollicis brevis. Importantly, the flexor pollicis brevis has dual innervation, with the superficial head innervated by the median nerve, but the deep head innervated by the ulnar nerve. Flexion of the thumb will be moving it across the hand, so we have flexion. And we have opposition of the thumb, the action of opponens pollicis. And opposition will be touching the finger pads of the thumb to the finger pads of the other fingers. And even though it's on here, the adductor pollicis will be innervated by the ulnar nerve, not the median nerve. A helpful mnemonic for some students is all for one and one for all, which shows the intrinsic muscles of the hand from lateral to medial. So to reiterate, most of the thenar eminence will be innervated by the median nerve, with the exception of that deep head of the flexor pollicis brevis. And the hypothenar complex and adductor pollicis brevis will be innervated by the ulnar nerve. Injury to the median nerve and loss of these thenar muscles can lead to ape hand. Ape hand is the inability to abduct the thumb away from the hand, leaving it stuck to the palm. Next up, we'll talk about the sensory innervation of the median nerve. The palmar cutaneous branch of the median nerve will innervate the lateral aspect of the palm, this area here. Importantly, although the median nerve travels through the carpal tunnel in order to innervate the fingers and the thenar eminence, the palmar cutaneous branch does not go through the carpal tunnel. It branches off of the median nerve before going into the wrist and thus goes over the carpal tunnel. The significance of this is that in carpal tunnel syndrome, which is compression through the carpal tunnel, the palm of the hand is often spared of the tingling and numbness that the fingers experience. In contrast, the digital cutaneous branches will go through that carpal tunnel, which innervate the palmar side and lateral 3.5 digits and fingertips. So the palmar or volar side of digits 1, 2, 3, and half of this. And what is the other nerve that's been sharing everything in the hand and forearm with the median nerve? That's right, the ulnar nerve will get the rest of the sensory innervation of the palmar side of the hand. Because the digital cutaneous branches will branch from the median nerve after it goes through the carpal tunnel, if there's compression in the carpal tunnel, there may be numbness and tingling in these 3.5 fingers, but possibly not in the palmar aspect of the hand. And lastly, we'll go over some causes of injury to the median nerve. One potential cause of median nerve injury would be a fracture of the humerus, specifically a supracondylar fracture, which is very common in pediatric patients if they fall on an outstretched hand. Additionally, any type of trauma, such as a laceration or penetrating injury from a stab wound or a gunshot, can injure the median nerve. Compression can also cause median nerve injury. Very commonly, carpal tunnel syndrome can affect those who are doing repetitive, fine motor movements that involve the wrist. This may be the case in a patient that types a lot at work, or maybe they just play too many video games without any wrist support. And finally, there can be compression from a tumor, such as a schwannoma, which is typically found in older patients. All right, let's go over a recap and then we'll do a practice question together. The nerve roots of the median nerve will include C5 to T1, which is all of the nerve roots of the brachial plexus. For the motor innervation of the median nerve, with the exception of flexor carpi ulnaris and the ulnar side of flexor digitorum profundus, the median nerve will innervate most flexors of the forearm, which will contribute to wrist and finger flexion. Additionally, the first and second lumbricals will be innervated by the median nerve, as well as the thenar muscles of the hand, contributing to the fine motor movements of abduction, flexion, and opposition of the thumb. The sensory innervation of the median nerve includes the palmar cutaneous branch, which will cover the lateral aspect of the palm, and the digital cutaneous branch, which will cover the fingers and fingertips. Common causes of injury may include a supracondylar fracture of the humerus, or a laceration from a traumatic injury, or compression, which can come from a tumor, or very commonly in carpal tunnel syndrome, which can come with tingling and numbness in the fingers, but because that palmar cutaneous branch branches off the median nerve before going in the carpal tunnel, the palm may be spared in carpal tunnel syndrome. A practice question might sound something like this. A 6-year-old male presents to your emergency department with left-sided arm pain after falling off a trampoline. The patient's mother reports seeing him try to catch his fall with his arms and thinks he may have broken his arm in the process. Vital signs include a blood pressure of 134/85, internal temperature of 36.8, and a heart rate of 98 beats per minute. On physical exam, you notice the patient has reduced sensation on the radial palmar side of the hand and 3 fingers, and 2 out of 5 strength with wrist flexion. Imaging shows a supracondylar fracture of the humerus. If left untreated, what area of the hand would be most likely to show muscle wasting given time? So as we mentioned earlier, a supracondylar fracture is a common cause of median nerve injury, especially in pediatric patients. And because this patient comes in with reduced sensation on the radial palmar side of the hand, in addition to weak wrist flexion, we can infer that there's median nerve damage. And so what area of the hand is innervated by the median nerve is the thenar muscles. So we will see wasting in the thenar eminence of the hand over time if left untreated. All right, guys, that's everything from me today. Thanks for watching. Good luck studying, and I'll see you next time.